信心百倍的打好这一场阻击战、总体战，打好这一场人民战争。
Day and night, the Yangtze River flows onward to the sea. For centuries, it has witnessed humanity's struggle with the unstoppable power of nature. At the dawn of a new decade, humanity faced a new threat. A virus emerged to launch an uncompromising attack on the life and health of people the world over. The iconic Huanghe Lo, or Yellow Crane Tower, has borne witness to the courage of a city and the efforts of a whole country in mounting a determined defense against the disease. The pandemic was unprecedented in the danger it posed. In the fight against it, heroes came to the fore who will From winter to spring, step by step, China overcame the challenges and rose above the dreadful hardship. In late December 2019, doctors in Wuhan encountered a mysterious pneumonia. On December the 26th, Dr. Zhang Jixian, director of the Respiratory Disease Department of the Hubei Provincial Hospital of Integrated Chinese and Western Medicine, was visited by an elderly couple. In 2003, the experienced doctor had been hailed for her expertise and dedication during the SARS outbreak. So when she checked her patient's chest CT scans, she was alarmed.
当初老太太有发烧、咳嗽，有点肌痛，做了肺部 CT， 是个双肺多发的膜玻璃阴影，以肺炎收住院的。进来以后呢，她家就丈夫也住到我们科里来了，他们两个 CT 的表现有类似。
However, Dr. Zhang realized this was no normal case of pneumonia. On the same day, another patient visited the hospital, complaining of a cough and fever. Dr. Zhang reported the cases to the hospital authorities, who immediately notified the Center for Disease Control in the Jianghan district of Wuhan. Over the next 2 days, the hospital took in another 3 patients with worryingly similar symptoms.
我觉得肯定是个不对劲的个病，但是具体什么病我也说不出来，所以我只好往上报，向上飞反映。
The hospital management immediately reported the situation to the local authorities. On December the 29th, the Hubei Provincial and Wuhan City Health Commissions ordered an inspection of the hospital by the Center for Disease Control. By this time, in less than 3 days, Dr. Zhang's department had been overwhelmed with patients displaying pneumonia-like symptoms.
怕慌啊！怎么有这么多人得这种病？
Before long, other hospitals across Wuhan were reporting similar cases. In ordinary conversations and on social media, people began to ask, what is this new unknown type of pneumonia? Other questions followed. What was the cause of this scary new illness? Where had the virus originated? Could it be treated? However, nobody knew the answers. On December the 30th, the Wuhan Municipal Health Commission issued an urgent notice concerning the treatment of this unknown viral pneumonia. On December the 31st, China's National Health Commission sent a team of experts to Wuhan. On the same day, the Wuhan Municipal Health Commission announced that a total of 27 cases of the unknown pneumonia had been confirmed. It advised people to avoid enclosed places with poor ventilation and large crowds, and urged everyone to consider wearing a face mask in public. The authorities wasted no time in responding to the outbreak. Throughout January, the Wuhan Municipal Health Commission issued regular updates warning the public as the number of confirmed cases continued to rise. On January the 1st, the National Health Commission set up a leading group to oversee the response to the disease.
On January the 3rd, the Hubei Provincial and National Health Commissions published 9 documents relating to the outbreak, including one called Diagnosis and Treatment Protocol for Viral Pneumonia of Unknown Cause.
On January the 4th, work began to organize training for the treatment of the disease. And on the 6th, a report on the outbreak was delivered at a National Health Commission work conference. By this time, the central government had become deeply concerned about the situation. President Xi Jinping ordered that controlling and preventing the spread of the disease must be made a top priority.
As the commander-in-chief in the battle against the disease, President Xi delivered a series of instructions.
On January the 7th, he laid out a specific action plan for the disease control work, which included a mass mobilization of resources. On January the 14th, the National Health Commission hosted a nationwide teleconference. It provided guidance for the disease control work in Wuhan and for preventing the virus from spreading to the rest of China. The country's leading scientists and medical workers promptly took action. They set about developing tests, determining the genetic sequencing of the virus, and isolating the individual strains. On the front line, the doctors and nurses made painfully slow but nevertheless significant progress in coping with a situation that was threatening to overwhelm them. Few doctors had expected the epidemic to develop so fast or anticipated the devastating impact the virus would have on the human body.
3号、5号的时候，就已经有70、80个病人在里面，而且重症病人又特别多，有的病人已经就垂死的状态，我们就知道这事情就很严重。
As the number of confirmed cases continued to rise, it became clear that the virus was being transmitted between humans. In mid-January, a patient at Wuhan Union Hospital developed a fever after undergoing surgery. A CT scan showed the presence of ground glass opacity, a sure indicator of the mysterious pneumonia. Before long, 14 doctors and nurses who had been in close contact with the patient also began to develop a fever. Despite the danger, Wuhan's medical workers were determined to remain on duty. As a result, more of them became infected. On January the 18th, the National Health Commission dispatched a team of senior experts to Wuhan. They arrived after midnight. The following morning, they held briefings with the local authorities and set about gathering information. The fact that so many medical workers had been infected confirmed that the virus was indeed capable of human-to-human transmission.
因为人传人是个大问题，是个大分界啊，这个习性传染病呢是最要害是这个，所以我们的专家组就专门针对这个问题来进行调查研究。
On the morning of January the 20th, the team left Wuhan for Beijing. That afternoon, they appeared at a National Health Commission news conference.
目前呢，已经证实了有人传人，也证实了有医务人员的感染。
Appearing on television that evening, Professor Zhong repeated his warning about human-to-human transmission.
针对人传人，现在的这个判断是什么样的？
目前的这个资料表示呢，它是肯定的有人传人。
By this time, cases were appearing in Beijing, Shenzhen, and elsewhere. It seemed inevitable that the virus could not be contained. In Wuhan, every hospital was inundated with patients.
忙不过来，从来没见过这种架势呀，这种阵势。
每家医院都排队，他的门诊这排队一塌糊涂，而且病人排队排到马路边上来了。
完完全全，我觉得状态就失控了。那个时候医院人满为患，有站着的，有坐着的，有躺着的，有相互依偎的，还有已经去世的病人都会有在里面，在很小的狭小的空间里面，大家真的是很痛苦，那个场面很痛苦，没有办法，作为医生没有办法，很无力。
The doctors and nurses worked around the clock continuously for days, to the point of total exhaustion. Often, they had to work without proper protection, as the equipment was in desperately short supply.
就是来搏命，当时没有办法讲什么防护了，当时手上的东西也不够，呼吸机也不够，面罩也不够，病区病机临时搭建嘛，太急了，知道吗？太急了，然后病人就涌进来，还有很多涌进来病人是你无法拒绝的，病人不行了，站在病房的门口，你收还是不收？当时收的话，我们的医生已经快崩溃了。
A shortage of tests meant many people with symptoms couldn't be diagnosed. Worried, they'd go from hospital to hospital seeking help. By doing so, they risked spreading the virus. Mr. Lei remembers how helpless he felt.
像我当时咳嗽已经都是，一咳嗽那就不得了，还是没法入院。
有没有去别的医院尝试一下？
去了呀，却都是满的呀，挤得没法挤，好像人就到了世界末日一样那种状态，那真是用语言是无法言表的。我现在想起来都是心有余悸，非常的害怕。
Wuhan was under siege. The virus was an invisible enemy, threatening to destroy people. Human life seemed so fragile in the face of the virus's attack. Gloom enveloped the city, made worse by the unrelenting winter rain. The history of human civilization is littered with tales of battles between humans and disease. Time and again, viruses have wiped out large swaths of the human population. Ancient Greece, ancient Rome, and all of Europe during the Dark Ages were crippled by plague. Through its battles with disease, humanity has learned to raise its civilization to a higher level. In the post-industrial revolution era, antibiotics and vaccines have been developed that provide protection against infectious diseases. In 2003, China faced a battle with SARS. The health of the world's population has repeatedly come under threat from various contagious diseases. In 2009, the H1N1 influenza, having originated in the United States and Mexico, eventually spread across the planet. Now, the world is grappling with COVID-19, a new coronavirus that very little is known about.
新冠病毒是跟我们以往的 SARS， 跟我们以往说的这个甲流都不一样，它的潜伏期比较长，症状不典型，可能有发烧，但也不太高。 可能有咳嗽，但可能也不那么明显。这样的一个不典型的症状，往往会持续1个星期甚至10天的时间，而它变成重型的时候，其实仍然症状不典型，往往表现为就是一个胸闷，直到它发生心脏骤停或者说严重的低氧血症的时候，表现才比较明显。我们医生们在讨论的时候，常常会说，这是一个很诡异的现象。
Faced with the deadly outbreak caused by an unknown virus, the medical workers and scientists rose to the challenge. The genetic sequencing of the new coronavirus was soon identified and its strains isolated. From January the 3rd onwards, China regularly updated the World Health Organization and certain countries and regions, including Hong Kong, Macau, and Taiwan, on the coronavirus situation. On January the 4th, the head of the Chinese Center for Disease Control and Prevention held a telephone conversation with his counterpart in the U.S. They agreed to maintain close contact and pledged to work together and exchange technical data. On January the 10th, the leaders of China's National Health Commission and Center for Disease Control and Prevention, in telephone conversations with the leaders of the World Health Organization, shared information about how to respond to the developing epidemic. Starting from January the 11th, China began to provide daily updates to the World Health Organization. On January the 12th, the World Health Organization announced that China had, by registering it with the Global Initiative on Sharing All Influenza Data, made the full genetic sequencing of the new coronavirus available to the world.
Of course, this is a novel coronavirus, and it's a new discovery. So identifying the pathogen was done swiftly, and it shows the capacity that China has now. And the sequencing was done quickly, but more importantly, it was shared immediately. And that's why Korea, Japan, Thailand were able to diagnose the new coronavirus quickly.
The COVID-19 epidemic is the biggest public health emergency to hit China since the founding of the People's Republic in 1949. Never before has a virus been so difficult to deal with in terms of prevention and control. Speaking on January the 20th, President Xi Jinping urged local governments at all levels to prioritize the safety of people's lives and health. He called for meticulous plans to be drawn up for controlling the disease and for decisive action to be taken for containing the spread of the virus. The State Council decided that COVID-19 should be added to the official list of Category B infectious diseases, with the stipulation that it should be treated as a Category A infectious disease. On the same day, President Xi addressed the serious challenge China was facing, saying, "The prevention and control work is crucial at the moment due to the large passenger flows during the Spring Festival holiday." Wuhan, as a major transport hub and the epicenter of the outbreak, was a cause of particular concern. Critical times call for decisive action. On January the 22nd, President Xi ordered the imposition of strict traffic control measures across Hubei and Wuhan. In effect, this meant the province and city would go into lockdown.
23号10时起，武汉市城市公交、地铁、轮渡、长途客运暂停运营，机场、火车站离汉通道暂时关闭，恢复时间另行通告。
车窗摇下来，后面有人没有？没有。把车窗都打开通风啊！
Since ancient times, quarantine measures have been used to curb the spread of disease. During the reign of Emperor Ping of Han, in 2 AD, China was swept by plague. According to the Book of Han, to stop it spreading, those who were infected were given an isolated space to stay and provided with treatment. However, to isolate a modern city with a population of over 10 million would be a far more daunting challenge.
在现代社会这样一种极为流动性很大的这样一个背景下，要想做出封城这样的决定很艰难，很艰难。但是我们也看到，要想抗击这么一场前所未有的巨大疫情，没有及时有效的彻底阻断传染源，它也是不可能的。那么面对这样一个两难的决定，需要清醒冷静的科学判断，更需要有坚定巨大的政治勇气啊！习近平总书记作为人民的领袖，他充分显示了这样一种政治担当和政治勇气，及时的、果断的做出了这样一个战略决断，所以我们才能在这么短的时间内取得这样一个明显的抗击疫情胜利的效果。
The lockdown of Wuhan, the epicenter of the outbreak, was only a first step. In the quarantine city, the pandemic continued to spread rapidly. The priority now was to increase the capacity of the hospitals so that everyone who needed it could receive treatment. With Wuhan and Hubei crying out for help, it was time for medical workers across the country to rally in support. The first medical assistance teams set out for Wuhan on Chinese New Year's Eve, when at normal times, families are getting together.
联合医疗队准备完毕，
出发。
是。
养兵千日，用兵一时，危难之时显身手，是革命军人、革命军医的本色。
我们来到这里的使命就是救人、救人、救人。
作为一名医务工作者，我义无反顾，我们一定能够战胜此次疫情。
3 days into the lockdown, 17 medical teams from all over China, a total of 2,444 doctors and nurses, arrived in Wuhan.
More assistance was soon on the way. China was dispatching its very best medical workers to the epicenter of the epidemic. On January the 25th, President Xi convened a meeting of the Standing Committee of the Political Bureau of the CPC to assess the situation and mobilize and deploy additional forces. Chinese New Year's Day is typically a time for family reunions, but President Xi chose to work instead. At the meeting, he emphasized that people's lives must be the government's top priority and that its key responsibility was to curb the spread of the disease. The decision was taken to set up a central leading group for novel coronavirus prevention and control, headed by Premier Li Keqiang, with Wang Huning as its deputy. And so the whole party, the entire military, and all the people were mobilized in the war against COVID-19. Those fighting on the front line, whether they were medical workers, patients, or ordinary citizens, now enjoyed the full support of the whole country. The leading group for novel coronavirus prevention and control would play a key role in the war on the virus. It met frequently, responded to developments in the situation swiftly, and conducted regular inspections of the front line to make sure that the CPC Central Committee's policies and decisions were being enforced effectively. Guidance groups were dispatched to Hubei and other provinces badly affected by COVID-19. In a display of solidarity with the people of Hubei, Vice Premier Sun Chunlan led a central guiding team to the province on the third day of Chinese New Year. Meanwhile, the State Council's Joint Prevention and Control Mechanism was coordinating the various forces taking part in the battle to defeat the virus.
Winning a battle requires a sound strategy. During the first month of the Chinese New Year, President Xi convened 4 Politburo Standing Committee meetings. He called for confidence and solidarity, a science-based approach, and targeted measures in tackling the epidemic. This directive formed the basis of China's main strategy in the fight against COVID-19.
对中国人民来说啊，我们现在正在进行着一场严肃的斗争。中国政府呢是高度重视，因为政府的宗旨呢就是把人民的生命安全、身体健康放在最高位置上。所以对这一次的疫情防控工作呢，我一直是在亲自指挥、亲自部署。我相信啊，只要我们坚定信心、同舟共济啊，科学防治、精准施策，我们一定会战胜这一次的疫情。
During his January the 28th meeting with the WHO Director General in Beijing, President Xi described the virus as a devil, which must be hunted down.
我觉得我的城市并没有停下来，只是它的脚步很慢而已。
这种国家也是费了很大的力气在拯救。快点，快点，快点！十二线速，十二线速！回来了，回来了，回来了！听到嗓子眼，我真的太紧张了。哎，好极了，顺利撤兵，非常好，99.9%。
In the battle against the virus, the whole nation was galvanized. By the start of February, the situation in Wuhan was deteriorating even further. Exactly how the virus was transmitted remained a mystery. A large-scale outbreak seemed inevitable. Every hospital was overcrowded. All people could do was wait, either to be tested or to be treated. In this city under lockdown, millions of people were living in fear. Saving lives was the priority, and it called for swift action. President Xi issued guidelines for the disease control and prevention work and pandemic treatment, which focused on early detection, early reporting, early isolation, and early treatment. Patients would be treated in dedicated facilities, staffed by senior medical professionals from across the country and equipped with all the available resources. The aim was to raise hospital admission and recovery rates while reducing infection numbers and fatalities.
退一点，45吧，我放到45吧。
心电图继续放。
往后退一点，往后退一点，打字退一点，打字退一点，打字退一点，对，打字你听得清吗？好了好了，好了。量个血压。
血压97/66，好的。
Wuhan was suffering a high rate of severe and fatal cases. Despite having access to some of the best medical resources in China, the city still lacked sufficient intensive care units. Even at a major facility like Wuhan Union Hospital, there were only 55 ICU beds. Faced with the dramatic increase in potentially fatal cases, the local ICU capacity was simply unable to meet the demand. The solution was to build dedicated COVID-19 hospitals.
On February the 3rd, at another Politburo Standing Committee meeting, President Xi proposed that dedicated facilities be built urgently to treat COVID-19 patients.
They would have access to the expertise of senior medical professionals from all over the country and all available resources. 3 additional hospitals were designated to treat severe cases, to be staffed by the very best ICU professionals.
$200，你先打200。我们在第一次血气的时候，我们看它的变化。
By February the 19th, 36,000 medical workers had come to Hubei's aid. Over 15,000 of them were ICU doctors and nurses, almost 10% of the total number in the whole country.
OK， 好，可以。
为了把病人抢救回来，我们动用了所有的这种高级生命支持，国家都是不计成本的救治病人，就是希望能够把这种危重的病人抢救回来。
我们大家努力，我相信天道酬勤，我们努力了肯定有好的结果的。
To increase the survival rate and lower the fatality rate, early detection was the key. The People's Liberation Army was tasked with running Huoshanshan Hospital. A military medical assistance team arrived in Hubei on February the 2nd and officially took over the hospital. Amid this unprecedented public health crisis, many people were experiencing panic and fear. Speaking on January the 20th, President Xi emphasized the importance of disclosing information in a timely fashion and deepening international cooperation at the same time as keeping the public informed of the latest policies for dealing with the epidemic.
By January the 27th, the State Council, through its Information Office and Joint Prevention and Control Mechanism, was hosting daily press briefings to update the world on the situation.
In Hubei, Wuhan, and many other parts of China, local governments started releasing information regularly and systematically. In time of war, those who are in leadership positions are held responsible for the decisions they make. President Xi promised that the central government would look into people's complaints and concerns and respond accordingly.
哎，等一下，什么东西来？统计线。统计线放怎么那么高啊？这会儿。看一下。突然那么高。
At the start of the crisis, President Xi had called for a coordinated national response in epidemic prevention and control. The CPC Central Committee had established a powerful and efficient command system. Party committees and governments at all levels gave their support to the unified command, coordination, and deployment system. Several provinces and cities activated their first-level major public health emergency response mechanisms.
Since Wuhan was not the only city in Hubei to be badly affected by the epidemic, 19 other provinces across China decided to offer aid to 16 other areas, cities, and prefectures in need.
Before long, the Joint Prevention and Control and Mass Prevention and Control programs were emerging as the two most effective approaches to curbing the spread of the virus.
现在进行社区疫情通报，在此呼吁社区广大居民科学防控，切勿恐慌，理性对待。
It was Chinese New Year, when traditionally across China, people travel back to their hometowns. In light of the situation, the CPC Central Committee called on people to refrain from traveling in order to limit the transmission of the virus. It also moved to extend the holiday to encourage people to stay where they were, and implemented policies for schools, factories, and companies to postpone their restart following the break. Logistical support was crucial to winning the battle. Factories restarted the production of the protective suits and masks that were urgently needed on the front line, and also found creative ways of increasing productivity. The government ensured central coordination by taking control of all key resources. A green passage was created to allow the more efficient shipment of medical resources and other essential supplies to epidemic-stricken areas, in order to guarantee that they arrived as quickly and safely as possible. Energy supply systems were unaffected. During the extended vacation, people who were quarantined in their homes didn't have to worry about a lack of amenities. And even though there was not much traffic on the roads, filling stations stayed open. On February the 10th, President Xi joined the Beijing leadership in reviewing the capital's COVID-19 prevention work. He stressed that the community as the front line The CPC Central Committee, with Xi Jinping as its core, demonstrated its power to galvanize and unite the country with its resolute strategies and steadfast confidence. Many ordinary people became heroes. Even the shuttle bus drivers who transported the doctors and nurses during the lockdown exhibited great courage in doing their work.
我们尽量的就是在他们就近的位置让他们上车，他们也蛮辛苦。
The community workers who helped quarantined residents were also everyday heroes.
这个国家现在肯定需要有人挺身而出，我觉得我需要到前线来。
The police officers who remained at their posts, carrying out disease control and prevention work, were also heroes.
那你设点到现在都没回去啊？
都没有回去，同志都是全勤。
The delivery drivers who kept the city supplied with daily necessities have also been hailed as heroes.
老不光怀孕，我万一染上了怎么办？有这个想法。后来我就一想，疫期间每个人不可能置身之外的，毕竟是帮助大家解决这个民生的问题，很重要的工作，我肯定要来的。
Across China, medical equipment factories worked around the clock to meet demand.
就是能保障中国人他困难，有什么活的哪个国家都有。
As the situation worsened, people outside China began doing what they could to help. Relief supplies started arriving from all over the world. The epidemic was devastating, but Wuhan and Hubei were not fighting it alone. The whole of China and even the world was with them. By February the 23rd, China had been fighting the virus for well over a month. A special meeting was held in the Great Hall of the People in Beijing.
继续毫不放松，抓紧、抓实、抓细各项防控工作，不获全胜，绝不轻言成功。
After over 2 months of hardship, March saw life and work steadily returning to normal. President Xi, though, reminded everybody to remain vigilant, even as the country endeavored to resume regular economic and social activities. While stressing the need to maintain strict epidemic control and prevention work, the president expressed the hope that the country would soon be back on track. On March the 2nd, President Xi visited scientists and researchers in Beijing who were working to combat the coronavirus. He emphasized that science and technology were the key to defeating the epidemic. On March the 6th, President Xi addressed a symposium on poverty alleviation. He stressed that poverty alleviation work should be promoted with even greater intensity so as to mitigate the impact from the coronavirus outbreak. Four days later, on March the 10th, he traveled in person to Wuhan. There, he encouraged those who were fighting on the front line. He praised the contribution of the medical workers, PLA personnel, social workers, police officers, grassroots and higher-level officials, volunteers, and ordinary residents. He called on everyone to remain vigilant and persist with the epidemic control and prevention measures in order to achieve victory in the battle against the epidemic in Wuhan and Hubei. Throughout March and April, President Xi convened multiple meetings of the Political Bureau and its Standing Committee. He offered fresh and timely instructions based on the latest understanding of developments in the epidemic in China and across the world. In view of the rapid global spread of the virus, he shifted the focus of the epidemic control and prevention effort to guarding against imported cases and a possible resurgence in China. On March the 26th, President Xi took part via
江河流。